Do you want to learn more about dialysis technique? Then go to Nephlearn app on Google Play Store for more details.
But what are the strategies that we can have for improving the engagement?
Sir, first of all, yeah.
Yes, please.
Thank you for inviting me as a panelist here. How do we improve patient engagement so that there is reduction of risk and there is improvement of patient safety in the dialysis units? Is that right?
Yes.
Yes. There are Deming's famous quote is that quality is everyone's responsibility. And in this everyone, I would like to include the patient and the caregivers and the relatives. So let us not forget that it's not just healthcare staff, but patients themselves, like Mr. Sagar said, who are coming lifelong, who need to be involved and engaged. So there are many studies that have been done by American Nursing, Nephrology Nurses Association or American Society of Nephrology. There is a choice study. And all these have pointed to a few particular concerns. One is patient falls, which has been mentioned earlier also. Medication errors. But by medication errors, Dr. Saravanan had mentioned that we should do medication reconciliation and other things. But not only that, in dialysis, it also means the dialysis prescription, the preparation of the dialyzer membranes, the preparation of the machines also sometimes. Then there is loss of infection control protocols to be followed and lack of communication. These are many concerns which are to be addressed in a unit. So how do we ensure that the patient is involved in all of this? So there has been a model which is described in American Journal of Kidney Diseases. And there are 4 aspects. First is patient education, like Mr. Sagar again mentioned, patient communication, patient participation, and last and not the least is patient empowerment. Now, how do we go about patient education? So there are things like one-to-one conversations, but the nephrologists usually are short of time. There's a dearth of time for them. So it is important to involve our healthcare staff. And recently what we have done is started involving the older patients in the counseling of newer patients. That works wonders because they have a sense of confidence building up in them that, okay, if this patient can do it, why not I? If this patient already knows so much, why not I? So patient education is very important. Once they are educated, their knowledge and skills are improved, then they can take part in the communication and be confident about voicing their concerns to the healthcare staff. Joint Commission, one study has been done in which only about 20% of the patients on dialysis felt little bit confident about telling the healthcare staff their concerns. So imagine 80% are just quiet and not saying anything. And even the 20% are only slightly confident, not very confident either. This needs to change. So what we need to encourage is that therapeutic communication is something which is goal and purpose driven. It's not just social communication like, how are you feeling today? It's about like, what did you have any symptoms the other night? Are you okay between the 2 dialysis periods? Intradialytic period and things like that. They need to be educated and therefore then they will communicate better. So what is the other education that's important? They must know about adequacy of dialysis and what the machine is being set up, what the dialyzer does, what is KT/V, what is URR. These are things that even patients should know. Why only the technicians? Okay. The third aspect is patient participation. So we have found very often that when you involve the patients in their own medication reconciliation, for example, we ask them to bring their boxes to the unit. So once the boxes and the prescription are matched, we often find, oh, so even the healthcare staff, even the patient's relatives, even the patient himself, they are all involved and engaged in that activity. So patient participation works wonders, not only with that, with their diet protocols, with the fluid that they consume. In all ways and manners, if you engage patients in participative activities, it works better in the long run because then they are more responsible for their own healthcare. We don't want the responsibility only to be on the healthcare providers or the doctors and nurses. Even the patients and the caregivers need to be responsible. This is like 16 years on dialysis, 20 years on dialysis. It's found that they are very adept at voicing their concerns in a very firm and assertive manner. And there is even a program in USA which is known as the Speak Up program for dialysis patients. They are encouraged to speak up and say, okay, do you think this infection protocol is not being followed here? They will gently remind the technical staff because we need to understand they are on dialysis for 20 years, but the staff which is attending them may be just a newly appointed technical staff, or it may be, somebody who is only 2 years experienced in this field. Compared to 20 years of the patient experience, 2 years is not much. So it is nice that the patients are encouraged to do all these activities, but this requires a lot of openness on the part of the unit, on the part of the owners. And there is where all the quality initiative begins, where the management, the top management's commitment has to be seen in all of these endeavors. And I'm sure with this, one day will come where we will be happily working together and being responsible for healthcare. Recently, I've come across a kidney health coach course, which is free online at just about 4 hours in duration, which even patients can undergo. It's not just for healthcare workers. This is by the American Association of Kidney Patients. And there is a similar program which is by the Kidney, I think a Kidney Foundation it is, I forget which one, in which an entire course module of 13 modules is there. Even patients can undergo that, and you ask them questions as a healthcare worker. What about anemia? Do you know what erythropoietin does? Are you aware how much your hemoglobin is? Do you know what hemoglobin is in the first place? What is its role? So there are online courses like that. जब इमरजेंसी होती है तब आपको डर लगता होगा। हाँ, तब फिर आपसे बात कैसे करते हैं स्टाफ वगैरह सब?
हाँ, बात करते हैं हम। पूरे स्टाफ अच्छे से बातें करते हैं और सब कामों काम लग जाते हैं बराबर। और ऑक्सीजन की तरफ जाते हैं और
उनके काम सही सलामत करते हैं। लेकिन आपसे कोई बात करते हैं क्या
तब बात करते हैं ना, ओ घबराना मत, ऐसे हमको हिम्मत देते हैं, हम है ना, सब लोग ऐसे बोलते हैं हिम्मत से।
जानकारी देते हैं क्या कि क्या हो रहा है कॉम्प्लिकेशन?
नहीं, थोड़ा वो बोलता है कि फेफड़ों में पानी भरा इस वजह से होता है ऐसा, घबराना मत, हम लोग है सब